Welcome back to Cycle Wisdom, where we empower women to restore natural menstrual cycles to improve health and promote fertility. I'm your host, Dr. Monica Minjeur, and I am so glad you're listening today. Today, we're going to be talking all about IUDs, or intrauterine devices. I'm going to briefly talk about the two different types of IUDs that are available, as well as discuss some of the risks or side effects that you may not be aware of. We will discuss reasons why I don't ever recommend these for my patients, and I'll give you alternatives for avoiding pregnancy or controlling heavy bleeding that focus on a different approach to work with your body rather than putting something in you that is supposed to be there for many years. So, as always, let's start off with a patient story about a client of mine who we'll call Mackenzie. Now, Mackenzie had gone to see her gynecologist because she was having very irregular bleeding. She unfortunately was suffering from heavy periods where she would bleed for 7 to 8 days, have lots of cramping, and sometimes even feel lightheaded or dizzy like she was going to pass out. On top of this, Mackenzie also was having significant pelvic pain. Now, because of all of these symptoms, when she saw her gynecologist, they actually recommended that she try an IUD to manage her symptoms. So she had the IUD placed, and although her bleeding decreased a little bit, she was now having spotting or light bleeding almost every day. Additionally, her pelvic pain became so bad that she was missing work. She also noticed a new symptom, and that was that she had significant pain anytime she had intercourse, and sometimes even when she was just urinating. So she came to see me for a second opinion because she was terrified to have her IUD taken out since her previous symptoms were so bad. She didn't want to trade in and go back to having the irregular bleeding and the heavy periods. And so we talked through what this would look like if we were to remove the IUD in the future. Before getting it removed, we actually began with some lifestyle changes. So we talked through things in regards to her diet, things that were causing inflammation, exercise level, as well as her stress and sleep. I also referred her on to see a pelvic floor physical therapist in order to help with the pelvic pain to see if there was maybe some other reasons why she was having such significant pain and cramping. And then I asked her to consider getting the IUD removed after she had started those interventions. Now, I followed up with Mackenzie a couple of months later, and she said the pain was getting better. She was still having that daily spotting and bleeding, though. And so again, I suggested that she consider getting the IUD removed, which she did. Approximately 2 weeks later, I checked in again, and her pain had completely resolved, which allowed her to get back to baseline with her cycles so that we could evaluate further. After the IUD was removed, she found that her pelvic pain was completely gone, largely from working with the pelvic floor physical therapist, but also because of the lifestyle changes she had made. We were able to identify the underlying cause of her irregular bleeding and worked to fix that instead. And she doesn't miss the IUD at all. So let's start with talking about the two different categories of IUD that are out there. Now, the more common version of an IUD is a hormonal IUD. And what this means is that there is a synthetic progesterone that is implanted into the IUD itself. Now, these IUDs are typically approved for anywhere from 3 years up to 8 years, depending upon the brand. Now, the progesterone that is a part of this IUD is designed to thicken cervical mucus and prevent sperm from getting to the egg. Now, some of the mechanisms of this are not completely understood, but in theory, that's how it works. Most often, these types of IUDs will make your menstrual period stop altogether, but for women that are still having a menstrual cycle, they oftentimes will notice lighter bleeding. The other type of IUD is considered a non-hormonal IUD, or these are also called a copper IUD. Now, these are approved to be placed for up to 10 years, and women will still generally have a monthly period on this. For some women, though, they may notice that their periods are heavier, longer, or have more cramps with them. So the way that the copper IUD works is that it creates an immune response in the uterus, which makes a toxic environment for the sperm. In addition to this, both copper or hormonal IUDs will cause irritation of the lining of the uterus to prevent implantation, so that even if fertilization occurs, then it makes it highly improbable for that fertilized egg to implant in the sidewall of the uterus. Now, let's talk about some side effects of the IUD. And some of these are things that are, listed in the package insert, but there are some other serious risks that are more rare, but I really want you to be aware that they do exist. So, most commonly, the side effects that we see are cramping, typically at the time of insertion as well as afterwards. Most gynecologists will tell you that this cramping should resolve within 2 to 3 months after having it placed. The other common side effect that we see is irregular bleeding. So, as I mentioned with the copper IUD, oftentimes we'll see heavier bleeding that's associated with that type of IUD. Whereas if you have a hormonal IUD placed, oftentimes you'll have a much lighter flow. But some women do have that continuous bleeding that happens, just some daily spotting. So, important to realize those things is that some women come in and they think the IUD is just going to stop their periods altogether, and that's really not always the case. Other side effects to be aware of is that there is an increased risk of benign ovarian cysts. Theoretically, this is happening because your body is trying to ovulate, but if you have, for example, the hormonal IUD, the synthetic progesterone can throw off that ovulatory event. So you have these follicles that are trying to develop, but since the progesterone levels never change or shift, that follicle never ruptures, which can cause that cyst to just remain there. Something else interesting to note is that IUDs can be inserted incorrectly. Even the manufacturers have done studies and show that up to 10% of the time an IUD is not placed correctly, meaning it is either put in too far or not far enough into the uterine cavity, and this can cause some significant problems. Even if your IUD is placed correctly, your body will reject it and kick it out about 6 to 10% of the time. If an IUD is placed into a younger woman from age 14 to 19, this expulsion rate increases, and about 18% of these young women will have the IUD fall out on its own, and some women don't even realize that happens. Now, even if your IUD is in place where it's supposed to be, it can cause some significant inflammation of the uterus. Now, because it's a foreign device that is inside that uterine wall, we oftentimes will see women have troubles with brown bleeding, pain, cramping, or irregular cycles. This can actually also lead to endometritis, which is a longer-term inflammation of the uterine wall lining. Another thing that we see with an IUD is that you can have increased seriousness of infections. Because you have that IUD, there are 2 small strings that generally stick outside of the cervix itself. These can actually be a breeding ground for bacteria that can then migrate up into the uterus more easily. Women that are exposed to a sexually transmitted infection with an IUD are more likely to have increased problems because of that, even progressing on to pelvic inflammatory disease, which is a more serious infection that affects all of the reproductive organs. There are other less common side effects, but they're still important to realize that they do exist. Some women will notice significant increase in their migraines when they have an IUD placed. Other things to be watchful for include elevations of blood pressure, which can sometimes lead to a heart attack or stroke. At this time, an IUD is not recommended for women who currently have breast cancer, cervical, or uterine cancer because there is conflicting data about how an IUD will impact their cancer risk. For women who have a copper IUD placed, there are some times that people can be allergic to copper and not know it until that IUD is placed. Copper IUDs can also have an impact on your thyroid function as well as your estrogen levels, which can then throw off lots of other hormones throughout the rest of your system. So these side effects that we have just finished talking about are all things that are known side effects and that oftentimes are listed within the manufacturer's insert. However, I have rarely had a woman that has gone to see her gynecologist that has had all of these potential side effects explained to her. I want to shift gears for a second here and talk about some of the more serious risks of an IUD. Now, these are rare, but they're important to know about. I have personally cared for patients that have had some of these serious risks over the last 12 years of my practice. And because there are so many more women that are getting IUDs placed, I think we will continue to see these numbers increase. So I want you to be aware that these are potential serious risks that we can have with the placement of an IUD. One of the most common ones that is becoming more well-known about and is actually starting to be studied is a significant increase in mental health concerns for women who are placed on an IUD. In fact, there are increasing numbers showing that women are having sleep disturbances, new diagnoses of depression, anxiety, and panic attacks, as well as an increased incidence of suicide attempts after having an IUD placed. Another thing that has become more commonly talked about is uterine perforation or migration. So what this means is that an IUD that was previously placed appropriately then pokes through the wall of the uterus and either can get embedded in the wall of the uterus or can actually go all the way through the wall of the uterus and migrate somewhere else within the woman's pelvic or abdominal cavity. These always will require some type of surgical intervention, but there have been increasing numbers of case studies that show that surgery is not able to remove these without having to give a complete hysterectomy or cause significant other damage through surgery. The current rates reported for a uterine perforation of an IUD are 1 in 1,000, so very rare, but still not a risk I would want anybody to have to take. Let's talk a little bit about other things as far as pregnancy risks with an IUD. Now, if a woman gets pregnant with an IUD in place, it does greatly increase her risk of ectopic pregnancy because that embryo is not able to implant well within the uterus, so it implants in the tube instead. For those women who do have an embryo that implants within the uterus and there's an IUD in place, there is a miscarriage rate of about 50%. And if that pregnancy does continue, the increased rate of complications during that pregnancy goes up significantly because now there's a foreign body in that uterus in addition to a baby that's trying to grow. I have removed many IUDs from women who came in after getting an IUD placed, specifically for pelvic pain or pain with intercourse. Even though their gynecologist had told them, hey, the pain will likely resolve within a couple of months, just tough it out, you can do this. That pain doesn't go away for some women, and it takes removal of that IUD before we can get the pain to go away. So I see this as a common complaint in my practice that I believe happens much more commonly than what the literature is telling us. One other note as far as copper toxicity when it comes to a copper IUD is that a lot of women are told, well, if you're going to get an IUD, the copper one is much more safe because it doesn't have all the hormones in it. Now, some women will develop copper toxicity because the copper can create levels that are too high in your body. And signs of copper toxicity may include headaches, fatigue, nausea, depression, irritability, food cravings, mood swings, and brain fog. These may be sudden, they may be severe. And in fact, copper toxicity in other areas of medical literature is known to cause significant mood changes such that it can bring about manic episodes and delusions. So copper toxicity, although it is very rare, is not something to be messed around with. And when women are told that a copper IUD is more safe than an IUD, I would always counter, but nothing is safer than just not putting it in the first place. So ultimately, what am I supposed to do? My gynecologist has recommended an IUD, or I'm done having kids and I don't want to be that person that has a surprise baby when I'm 47 years old. You do have other options. We don't want to just be covering up some underlying problem like what was recommended for Mackenzie's case. For example, why did she have the heavy bleeding? Why did she have so much pelvic pain? And why did she have irregular periods? We want to be working through these things in a systematic way in order to treat symptoms, correct any underlying hormone abnormalities, and get to the root cause of what's going on from her hormone levels. It is also incredibly important to teach women how to chart their cycles because this helps you to have a better understanding of when you are fertile and when you are not. It also helps you to be able to avoid intercourse during those fertile times without needing to resort to an implant or a foreign body getting put into yourself. I also want you to be able to advocate for natural cycles for yourself. So many more women are being offered an IUD as a long-term method for contraception, for controlling symptoms, because they think it is easier. The mindset is set it and forget it, and you don't have to worry about it. But what we are increasingly finding is that these IUDs are causing more troubles than what we are being told. Imagine if you didn't need an IUD to manage your symptoms and could avoid all these potential side effects and long-term risks we talked about today. I would love the opportunity to work together to give you a better understanding of your menstrual cycles without any types of implants to improve your menstrual cycle and overall health. If you're ready to work with our elite team of healthcare professionals, go to our website, radiantclinic.com, to schedule a free discovery call with me and learn more about our package-based pricing for comprehensive care. We are currently able to see people for in-person appointments in the Cedar Rapids, Iowa area, or can arrange for a telehealth visit if you live in the state of Iowa or Illinois. Thank you so much for listening to this episode. Please share this podcast with someone in your life who would benefit from our services. Remember to subscribe to this podcast for more empowering content that I look forward to sharing with you on our next episode of Cycle Wisdom.